Hello and welcome back to All About Community. Again, when we went to break, I was talking with Dr. Michael Lenoir, and we were talking about his experience in the Navy, and now we're going to
Army,
talk a little bit about
Army.
Army. Thank you for that correction. Now we're going to talk about a little bit about his practice here in the Bay Area, and then ultimately we're going to talk about his national leadership and some of the stuff that he's doing. And then after that, we're going to talk about some of the hot issues of today. So locally, Michael, what is your practice here?
Well, I started out in the Bay Area when I got out of the service as an allergist. And I did allergy for about 5 years only. But it turned out that where I did practice, and I chose to practice in areas where other allergists were not, downtown central Oakland and in central San Francisco, it turned out that African American families did not have primary care pediatrics. So I started to accumulate, in addition to consulting allergy patients, a large number of Black families as a pediatrician. And so one day I just decided, that was more my interest. That's what I'd done in the service. I'd done mostly teaching and training and servicing in pediatrics with consulting and allergy. So then I just decided, hey, I may as well open it up. And people said, well, you aren't going to be successful at that because people are not going to send you patients. But turns out that it worked perfectly fine for all the years I've been in practice. And we still have separated our practices, but I still do both pediatrics and allergy.
And what do you see as some of the leading challenges confronting the health needs of blacks in general in the black community?
Well, I think everybody's now interested in health equity. That's what you hear. A lot of people don't understand what that means.
Yeah, explain it.
Well, what that means is that if you look at the African American community and you look at any chronic disease, we're sicker, we die more quickly, we just are affected by these chronic kidney diseases, asthma, cancer, diabetes. They affect us much more. And it is really not, it's not genetic. It's almost kind of by some kind of weird design that it goes all the way back to slavery, according to Dr. Hood, in which we were treated differently.
Is that Dr. Rodney Hood?
Dr. Rodney
Okay.
Hood, in which we were treated.
Who's also a former president of the National
Yeah.
Medical Association. Okay.
And we've been treated differently all through this whole era. And of course, there have been highlights and lowlights highlights have been that Black medicine has persevered in the historically Black medical schools, Howard, Meharry, some that have disappeared now, and some that have disappeared. And Black doctors continue to be educated men and women. Yet we're 12% of the population, we're 5% of the Black physicians in this country. And so consequently, because of that, a number of other more subtle things like unconscious bias, the way we're treated when we enter the healthcare system, that means that we don't get the same treatment and we don't get the same focus on our health needs.
Now, let me ask you a question that been bothering me and other people as well. Does it really make a difference to have a Black doctor?
Well, I think communication, as you know, being the esteemed husband of the author of a book about this very subject, we do know that communication is so key, and conceptualization, being able to understand a person's problem from a total perspective makes a difference in your decision making. I think one of the things that we see in even medicine today is that when you go into a non-Black health situation, you're looked at differently by that system, unless that system is completely redesigned. I think in our area, we've had some systems that were pretty much managed by African Americans, and they have a different, Kaiser being one, and you know the leadership there has always been concerned about that. Then the institution takes responsibility and accountability for the health of all of the patients. But if you're out in the system, you're going to find that the system looks at African Americans differently. Not just the institutions like the hospitals and the medical schools, but also the doctor's staff, the doctor himself, and all the ancillary services treat African Americans differently. All kinds of studies that support that. And from my perspective, that's been the biggest problem. in health equity. Now, then we got hot for a minute. George Flood, other things happened.
Mm-hmm.
All of a sudden, you start to see people say, well, and the coronavirus epidemic disproportionately affected African Americans, because they were the first responders, really.
Right.
They were the ones driving the buses, cleaning the houses, and they didn't know the virus was there. But secondly, we were sicker as a population. And when we're sick as a population, it made us much bigger fodder for this virus. And so consequently, more of our people have been sicker and more have died proportionally because we were a sicker group in terms of health equity. And so the biggest problem I see is that we have been depending upon some larger institution, AAC, CDC, to correct this problem. We've had healthy people 2010, 15, 20, 2005, and none of that has really raised the level of health in the Black community.
So the level of health in the Black community seems to, for whatever reason, and I know there are reasons, to continue to be far below the level as in the white community. So we're going to have to take a break, so don't touch that remote. Just put it down. We will be right back with All About Community. Again, my name is Robert L. Harris, and my guest is Dr. Michael Lenoir.